Maybe expand a little bit on the macronutrients of the carbohydrates, proteins, and fats.
Yeah, absolutely. I mean, it's very important. So first of all, the diet, the tricky thing about diet is that, first of all, it's very hard to study diets. The reason why is that it's very hard to blind patients. And without blinding to see the exact effect is very hard. So that's why the anecdote comes into play. So there is no question that there are some patients that improve significantly with fermented food and all that. But the most important thing is that one main thing that I wanted to differentiate is that we generally suggest not to have fermentable food, and fermented food actually generally are accepted. Fermentable food are the food that bacteria, it just becomes the fuel for the bacteria. They just go in there. I was like, oh, thanks for the meal. So, and now you're somebody with a small intestinal bacterial overgrowth. I was like, okay, now I'm going to have a party in the small bowel. So, because now you have fed them food. And what is the most fermentable food that we eat? Carbohydrates. So the sugars that we take, and also sugar alcohols. Sugar alcohols are, for example, are the sweeteners that we use in the food. So because they're extremely sweet and they don't get necessarily absorbed by us, but bacteria are well capable of breaking down sugar alcohols. And these are the most common sweeteners that we use. And those are the ones that can cause significant amount of bloating and accentuation of SIBO symptoms. Obviously, the other fermentable, non-fermentable foods are beans or the cabbage and all that. But the advantage of this diet is that it gives you a happy medium in between. It's easy for me to tell the SIBO patients, well, go out there, eat chicken and white rice, and you're going to feel better. It was like, well, thanks. How can I live like that, right? So you need a low fermentation eating strategy to kind of like help yourself and eventually get yourself out to a normal diet. And that's essentially what's missing. Another important thing in low fermentation eating is the concept of meal spacing. Because remember the migrating motor complex that I was talking about? They don't happen when we're eating. They only happen when we're in the fasting phase. So if you space your meals, then you have a higher chance of getting those migrating motor complexes and help your bowels, even though they are weak in the setting of small intestinal bacterial overgrowth. So if you graze throughout the day, that's the worst thing you can do to a SIBO. So, which is interesting, is somebody with gastroparesis, for example, that's my recommendation. I was like, oh, don't eat a huge meal and eat graze throughout. And that's the problem that we have with a lot of GI disorders, that we give different dietary advice to different diseases, and rightfully so. But if you have something else, then you're going to get 100 times worse. And that's the problem. That's, for example, sometimes you see one patient with on kefir is doing fantastic, and another patient is doing not that fantastic. And it's probably that's the patient with abnormal microbiome of the small bowel that you're not doing well with kefir, because I mean, so you just gave it a combination of pre and probiotics in the small bowel. So obviously that patient is not going to do well, but other patients will do well, right? Yeah. So for example, patients with IBD, it's a known fact that they do well with specific carbohydrate diet, right? So a lot of them are try that. But if you try that, for example, in many sort of SIBO patients, they don't do well. And that's where we are coming in saying that, hey, each disease needs its own diet and dietary sort of modifications, rather than trying to find one diet that works for every IBS patients, for example. I mean, that's not going to happen. Yeah. So you have to kind of like modify it.